Okay, we have Dr. Bennett here from TMJ Sleep Center, and we are talking about your child's breathing and why it's so important to be monitoring their breathing. I am shocked by this. I didn't know how their breathing can affect so much, not just their health, but their face shape. Tell us more about that.
Well, the way the face develops is it develops around the tongue muscle. The tongue pushes out, develops the skeleton of the face, and you literally have a better airway, more beautiful face when that process is allowed to be developed. If you can't breathe through their nose, then the mouth is open and that tongue pressure isn't there to develop the face.
Now, this is something that we obviously want to be paying attention to, but this time of year I feel like it's even worse. And I love that you brought some products that actually, Jesse...
Well, I was saying I need to grab some of this. Our friend Glacio was telling me about the kids' nasal spray because my kids are getting this at home now. And I'm monitoring their breathing to make sure they are breathing because they're getting colds. How does that affect everything?
Well, I think with the nasal sprays, that's important because that's the beginning of the immune system. If they're not breathing well, that means their air isn't being filtered into their body properly. And so they'll be more susceptible to sore throats, strep, large tonsils, croup, like your daughter. And so, yeah, like this picture. See the boy with it, the bags under his eyes, it's dark, the lips are apart, they're chapped, the teeth are dry. The nostrils, notice how small they are? They're not being used.
Interesting.
Can't breathe through his nose. So his face is developing abnormally as a result of that.
Oh my goodness.
And so he's going to have some major orthodontic problems. If you can imagine what his teeth look like, they're going to look like something eventually because the tongue isn't there to develop the space for those teeth.
At what age are you really wanting to focus in on that where you can kind of catch the problem when it's happening?
Well, actually, when you have an infant, that's the best time to talk about it because that's when the head, face, jaws actually develop. That's the most important part of the development during the first 7 years of life. And so if they have a pacifier, the suction force of the pacifier actually pushes the jaws back in the head.
Oh,
and that's where you develop TMJ disorders and airway problems. And so now they're destined to a life of chronic problems, like pain and other disorders.
Okay, so what do parents do? If they see some symptoms, what should they do?
Well,
or what should they pay attention to? I think it's like...
Yeah, I mean, that picture that you saw with the kid, they should be looking for dry lips. They should be looking for a kid that just doesn't feel refreshed in the mornings. If they're underperforming in school, if they wet the bed, actually.
Interesting.
There's a lot of things that the child just fails to thrive as a result of not breathing well and sleeping well.
I feel like we've got a lot of that going on at my house right now. I'm not even kidding. So I see these symptoms in my kids. I know I can help with the seasonal with all of these great Xlear products, but what do? I call you?
Well, yeah, we'll be happy to visit with you about it and kind of set a long-term strategy. And you can avoid a lot of long-term costs, having to pay for orthodontics and other things as a result of that.
And it can be fixed, is what you're saying.
Yeah.
Do you get to a point where it's too late?
You can, no, even in adulthood, the bones will develop, but it's much harder. It's best to do it when their body's so growth-oriented during the first 8 years, especially. But these products are important because I prescribe them to patients to use to enhance breathing function. And now we can get the musculature in the right place so their faces develop.
This is so crazy. Had you ever realized that that breathing affects that? Oh my gosh.
But it makes sense when you talk about it.
No, well, you need to talk to Dr. Bennett. Be sure to go to their website and also see TMJ and Sleep Therapy Center of Utah. They're down in Orem. And if for the next week, if you mention good things, you'll get 10% off your evaluation.
That's awesome.
That's nice of you.
Yeah, thanks, Dr. Bennett. We appreciate it.
You're welcome.